let's continue. Click on Statements. And all of these screens you'll notice have the same kind of a theme. You're going to have a criteria, and then you're going to do a search. You're going to have a list that you can edit. So in this one, step 1 is select your doctor. Again, you use the folder to the right. Where visit balances have aged at least, you can put a certain amount of days in here if you don't just want to pull all of them. Where each visit is a minimum of, you may want to put $5. Maybe you don't want to print up bills for less than $5. Print statements even if there's only an insurance balance. Sometimes doctors like to show the patients at least what they're sending to the insurance, even if there's no patient balance. You can check that box off in order to do that. I'm going to leave mine blank. Skip a statement if printed on or after a certain date. Maybe you printed a single statement or printed statements for some of your patients recently and you don't want to print those again. You can put that date in here. Skip patients on a payment plan. This is available for our orthodontic and enterprise users. If you don't want to print people that are on a payment plan, you can check that off here. I'm going to leave mine unchecked because I do want to bring everybody in, including people with payment plans. Show all payments on multiple billing party visits. What this is, if there are multiple billing parties for a particular patient and their charges, and you want all of the payments to show on the bills for both billing parties, you can check that off here. If you don't want to show all payments, uncheck that and you'll only see payments related to the specific billing party and their statement. Mark statements as printed when removing them from the list. You'll usually want to have this marked as yes because you'll want this to be able to work where if you want to filter out certain statements that have been printed, you want to make sure that's yes, and it'll post that on all the visits to let you know that you printed it. Plus, it's a nice thing to be able to look back and on the actual claim and see the date you printed it. So you should always have that marked yes. Unless you're doing some sort of a test or resubmission and you want to mark it no. I'm going to do no because I want to be able to repeat this procedure if possible or if necessary for training purposes. I can also put a message on my statement. Maybe there's a holiday coming up, or I want to let my patients know that there's an up and coming vacation time where we'll be closed. Something like that, just a universal message to all the patients. I can also choose to show credit card payment information boxes on a statement. If you remember in general settings, you can set up messages for the credit card saying basically that you accept Amex, MasterCard, Visa, Discover, whatever. You can also check and uncheck that here to show it or not show it. And you can have a specific date to print at the top of the statement. Maybe you're going to print them today, but you're not going to mail them until tomorrow. You may want tomorrow's date on there so that officially it's stating that the statement was sent on such and such a day. Click on search and it'll find all the statements that meet that criteria. Shows me the insurance total, the patient total, and the visit total, and the due now. The due now is the payment plan amount for these patients that's currently due. If they have only one payment plan up, it'll print that particular payment plan. If 2 months have passed and they haven't paid 2 payment plans, it'll show the accumulation of the 2 payment plans and so on. You can also print this list for review on paper prior to printing your statements. You can also print labels on this screen to send out with your statements, but if you use a number 9 window envelope, these statements will fit beautifully into that. You can also double click to tag just like in the other batches, remove any bills that you don't want to go, narrow down which ones you want, and then click on print to print your statements. It'll tell you that the process cannot be reversed once you do it, and basically what it's going to do is print the statements, and because I chose no to mark my claims, it will not mark them as being sent, but you'll have it marked a yes. And this is what the statement looks like. patient name, all the transactions. Here's that credit card information I was talking to you about. You can make that say whatever you want or not print it at all. Shows the total insurance balance, total patient balance, and pay this amount. This pay this amount may vary if they're on a payment plan. And like I said, this will fit very nicely into a number 9 window envelope. Let's exit out of here. Cancel. And it's going to ask me if I'd like to empty the batch, which I'm going to do. If you decide to come back here for further review, if you get interrupted, need to come out before doing your batch, or you're working it and want to print it at the end of the day, you'll want to say no, and it'll save everything in here as is. I'm going to empty my batch to clear it and exit out.